Hey everybody, Forrest back with you at Life Assist, clinical product specialist and licensed paramedic. And today we're going to be talking about oxygen administration. Really excited about this one. So the goal of oxygen administration in EMS is basically to maintain healthy levels of oxygen in our bloodstream so they get to all the tissues and organs and cells in the body. That's it. That is what keeps us alive. We have to have a constant supply of oxygen, so it's one of those things that is very important. So back to school real quick. Remember we talked on our previous videos. In our atmosphere, there's roughly 21% of oxygen floating around. Now, due to some conditions that people have, that 21% is just not enough, okay? Conditions like asthma, COPD, CHF, lung cancer, pneumonia, stuff like that, a lot of those calls that our customers run on, they require supplemental oxygen delivery, okay? So why is it important in EMS? Well, I gotta tell you, shortness of breath, difficulty breathing, you name it, it is one of the top calls that we get all the time. I would say easily in the top 5. So we are constantly using all the products for oxygen administration that we sell, okay? So what I'm gonna do is I'm gonna go over kind of each one. I'm gonna start at a low level and kind of work my way up, okay? So the first thing, the easiest, simplest way to deliver supplemental oxygen at a low level, meaning mild distress for the patient, just so they can get comfortable. Maybe their O2 saturation's a little bit low, but they're still breathing okay. They just need a little extra. We're gonna go with a nasal cannula. Okay, so this is probably one of the most common products used in EMS. It is a hollow, flexible plastic tube. It's got 2 nasal prongs that go in the nose, and the other end hooks up to our oxygen source, okay? This is gonna deliver roughly 1 to 6 liters per minute of oxygen, and again, it's for the mildly distressed patient. Also in the nasal cannula category, they are now, you're probably like, what is this? They are introducing high flow nasal cannula. It's a little bit newer. Some of our customers are using it. We sell the device, the actual cannula, but the rest of it has to hook to a special device that humidifies and actually heats the air because it's so high pressure that it can really dry out the nose and cause bleeding. So if your customers ask about high flow, we have that as well. Okay, so moving on to the kind of moderately distressed, maybe someone who needs a quick burst of oxygen right away. I wouldn't go severe yet, but definitely moderate distress. We're gonna move to what's called a oxygen mask. These go right over the face. There's a couple different versions of them, but basically one of the most common ones in EMS is gonna be the non-rebreather mask. And what's cool about these is that when you attach this to our oxygen source, it not only delivers that rich concentration of oxygen, but it has this reservoir bag here, and it fills up. So you always have a constant supply of fresh oxygen coming in. Also, what it allows is you to breathe out the waste, that CO2, and then it's got these little flaps here, so you're not breathing in much of the room air concentration, and you're constantly getting a good fresh supply of oxygen. A little twist to the kind of oxygen mask. It's not as popular anymore, but we do sell it. You might have heard the term, it's called a Venturi mask. And these are for patients or clinicians that need to give a precise percentage of oxygen to their patient. As you can see, it's got a similar look to the non-rebreather, but it's got these little inserts here. And depending on the insert that you put in, it's gonna decipher what percentage of oxygen is being given to the patient, okay? So if you hear the word Venturi, we handle that as well. Back to the non-rebreather just real quick. I did talk about, moderate distress. These can run anywhere from like 6 to 15 liters per minute. So that's the oxygen level we're gonna have those at. Okay, so now we're gonna go to, excuse me, nebulizers, okay? So nebulizers, what do nebulizers do? Nebulizers basically take liquid medication and turn it into a fine mist so it can be inhaled in the lungs. The most popular version of medicine that is used with nebulizers is going to be albuterol, okay? I'm sure you've heard that term before. Albuterol is for respiratory difficulty where the lungs are constricted and they're not getting that good supply of oxygen in. Albuterol opens up the lungs. And when we put the medication in this little device called an acorn, it takes that liquid and turns it into a mist, and then we can breathe it in like that. So very effective. We have two versions, the handheld, some people call it the peace pipe. And then we also have a face mask, which sort of looks like a non-rebreather, but it's got this special connection. The acorn, which is all tangled up here, but it basically just plugs in right there. So your patient doesn't have to hold it. It'll just bring that supply. And one thing to mention too is that we did bring on a special mask when COVID hit. It's called the Aerosolus. And this mask is cool because they created filters with it. So when you're giving a nebulizer treatment, sometimes a lot of that mist leaks out and it gets into the room air, and they were trying to prevent other people from breathing in that room air. So these ones are still around, or ones without filters. So if your customer is looking specifically to filter out, we got that as well. Okay, so that's nebulizers. Those probably run, I would say, typically to nebulize a medication correctly, 6 to 8 liters per minute, okay? Again, these all connect right up to our oxygen source, which is, we're gonna talk about in a second. Okay, here we are. Severe respiratory distress, severe. CPAP, continuous positive airway pressure. This is for extreme respiratory difficulty. Typically, we give these to patients with COPD and CHF. What it does is it keeps our airways open constantly and from collapsing so we can force a large amount of oxygen into their body. Also, what it does is it removes fluid in the lungs so you're not drowning in your lungs and allows, again, that fresh oxygen to keep coming in. There are tons of different styles of CPAP. But the main features on all of them, you're gonna have a kind of a head harness here with a nice mask that seals up perfectly. It's gonna have a pressure dial where you can determine how much pressure you wanna give. And it also might have an option to a nebulizer as well. If you need both, you can actually have a nebulizer option. So how does it connect? A little bit different connection. Since it's such high pressure, on the oxygen tank, we have high pressure ports. This thing will screw right into that, and it gives you that perfect PSI that you're gonna need to run this device effectively, okay? Again, work with your reps on this, your sales reps, because they are really tricky these days as far as all the different features, and your sales reps are the experts on CPAP, so they'll be able to help you out the most. Okay, so now that we've got all of our oxygen supply products, where do we get the oxygen from? Well, this is our handy dandy oxygen tank. This is what's called a D-tank. This is probably the most popular portable size oxygen tank in EMS. This is the one that they're gonna have on them with every call. It's the one that's on the back of the gurney. And the way it works is it stores under pressure in PSI, pounds per square inch, 100% oxygen, 100%. Once it's loaded into the tank, in order to control the pressure, and I'm moving over here, but I have to, we have what are called regulators. So when I screw this regulator on, all that pressure goes up into the regulator, and then I have a specific dial or these little connections that help me control the flow, okay? Because I don't want to open it up full blast. I'm going to blow the patient's head off. So now I'm having a hard time getting it, but here we go. Okay, so that's connected. And then again, we've got our little barb here, and that's where all the oxygen connects to, and you turn it on and set it to the right amount, okay? Finally, I want to go over here. It's way over here, but this thing right here is called a flow meter, okay? Flow meters are what you're going to see inside the ambulance, inside the wall of the ambulance. Those are going to be connected, and then behind the scenes, they're connected to a larger size oxygen tank. Okay, and again, all that's doing is allowing us is to create the sort of flow that we want to give that patient, whatever their oxygen need is. Okay, so we're going to move on now. We're going to talk about the manufacturers, and we're going to talk about some specific sales questions. All right, so who sells all this stuff? I mean, this is a lot of stuff, right? Yes, and we do have a lot of manufacturers. So I'll break it down kind of based on the different types of equipment. So for nasal cannulas, non-rebreathers, and nebulizers, I'm going to say that the big three are going to be Hudson, MedSource, and AirLife. AirLife, SunMed, we've gone through this. I don't know what their name is today. But those are going to be the big three, the most popular suppliers for that type. When we're moving into CPAP, CPAP's big players are definitely going to be Intersurgical. Mercury is going to be a big one. I would say those are pretty much the two biggest players. So definitely, again, like I said, if you're talking CPAP with your customer, it can get confusing. Reach out to your sales reps. They will give you all the little nuances that you need to know in order to have a good, healthy conversation. Okay, moving on. So let's talk cylinders. Cylinders, we have a couple different manufacturers. I'd say our most long-standing relationship that we have is with Merit. Merit has been with us for a long time. We sell a ton of Merit cylinders. A kind of a new player on the block that we brought in is Meta Medical. They offer similar type cylinders that Merit does, and also regulators too. So speaking of regulators, Merit definitely is another outstanding, long-standing relationship that does the regulators. Talked about Meta. Other couple places that do regulators, O2 Medical, Drive Medical, and Flowtech. Now, Flowtech is a very customizable type of regulator. They can do all kinds of crazy stuff, and they can engrave stuff. There's all kinds of things. A little bit more on the expensive side, but if you're looking for that super customizable regulator, Flowtech is going to be your go-to. Finally, flow meters. We have two main distributors or suppliers, and Genstar and Precision Medical. Those are going to be our flow meters, and that is pretty much our big players on the manufacturer side. So real quick, let's go over some sales questions. Here's the good thing about all this stuff. It's not hard to sell because it has to be in every single ambulance, all right? Especially an ALS ambulance. Advanced life support with paramedic, you're going to find most of this gear in there. So I think what you start out with is, what are you currently using now, right? Based on the nasal cannulas, non-rebreathers, nebulizers. You know, the chances are they might be using, if they're not buying from us, the same supplier. So then it's just going to be up to what kind of price points can we get? So pretty run-of-the-mill, what are you using? You can kind of gauge from there. Is there anything you like or don't like about what you're using? What kind of nebulizer do you prefer? Do you like the handheld masks? You have both. Venturi, do you guys still use a Venturi? There's possible, they might not. CPAP gets a little tricky. So definitely want to know what CPAP system they're using, why they're using that particular CPAP system, and are there any pros and cons to it, or any things they like or do not like. When it comes to oxygen cylinders, same deal. You just want to find out, where do they get their cylinders at? They might not even buy them from any of our major competitors. They might get them from a service who actually provides them rentals, and they fill them and switch them in and out. So regulators, same question. Odds are they're probably going to have a regulator that we carry, or they're already using. So again, just kind of talking to them, what features on the regulators they like. Is there anything they wish they could have better? All that kind of stuff. And then finally, the flow meters, same deal. What style do you have? Do you use Quick Connect? There's a lot of little questions. If you get confused on that, it gets a little tricky. Call Products. We can help you out to get you on the right avenue. Okay, you guys. That's oxygen administration. Our next training video, we're moving into pharmacology. Super stoked about that. Going to talk about the most common medicines, how they're delivered, all that fun stuff. Thank you guys for watching. Please don't forget my reference doc. It's got so much valuable detailed information about everything we just went over and fun pictures as well. Thank you. See you next time.